Hi there, I'm Dr. Helen Brook, urologist, and today we're going to talk about something that affects millions of people but nobody really wants to discuss: overactive bladder, or OB. Now, over my years in practice, I've had countless patients come to me embarrassed, frustrated, and honestly exhausted from constantly running to the bathroom. They want to know, is this normal? What's causing this? And most importantly, can we fix it? Today, I'm breaking down everything you need to know about overactive bladder. First, let's start with the basics. What is overactive bladder? Simply put, overactive bladder is a condition where your bladder muscle contracts or squeezes when it shouldn't, creating a sudden, intense urge to urinate that's difficult to control. Think of it like having a smoke alarm that goes off when you're just making toast. Your bladder is sending urgent signals even when it's not actually full. Now, your bladder is essentially a muscular bag that stores urine. The muscle that makes up the bladder wall is called the detrusor muscle. Normally, this muscle stays relaxed while your bladder fills up and then contracts when you're ready to urinate. But with overactive bladder, this detrusor muscle starts contracting involuntarily, even when your bladder isn't full. It's like having a muscle spasm, but in your bladder. The 4 main symptoms of overactive bladder. Overactive bladder typically presents with 4 main symptoms, and you don't need to have all 4 to be diagnosed. Let me break these down for you. Urgency. This is the hallmark symptom. It's that sudden, compelling urge to urinate that's difficult to defer. We're not talking about the normal sensation of needing to go to the bathroom that you can easily hold for a while. This is more like your bladder is screaming at you, "Go now," and it feels almost impossible to ignore. Frequency. This means urinating more often than normal. Generally, we consider more than 8 times during the day to be frequent. Some of my patients tell me they're going every hour or even every 30 minutes. That's definitely not normal. Nocturia. This is waking up at night to urinate. While it's normal for older adults to wake up once during the night, if you're waking up 2 or more times consistently, that's considered problematic. I've had patients tell me they're up 4, 5, even 6 times a night. Imagine how exhausting that is. Urgency incontinence. This is when you actually leak urine because you can't make it to the bathroom in time. It's that key in the door syndrome where you're fine until you get home, put your key in the door, and suddenly you're leaking. Or you're in the grocery store and suddenly you feel that urgent need and you can't make it to the customer service desk to ask where the restroom is. What causes overactive bladder? Now, you're probably wondering, why is this happening to me? Well, overactive bladder can have several different causes, and sometimes we never find a specific underlying cause. We call this idiopathic overactive bladder. Neurological conditions can definitely cause OB. Things like multiple sclerosis, Parkinson's disease, stroke, or spinal cord injuries can affect the nerve signals between your brain and your bladder. Essentially, the communication system gets disrupted. Bladder irritants can trigger symptoms. These include things like caffeine, and I know nobody wants to hear that their morning coffee might be part of the problem. But caffeine is a bladder stimulant. Alcohol, artificial sweeteners, spicy foods, and acidic foods like citrus can all irritate the bladder lining and make symptoms worse. Urinary tract infections can certainly cause urgency and frequency, but the difference is that UTIs usually come with burning, pain, and sometimes blood in the urine. If you have a UTI, treating the infection will resolve the symptoms. Bladder stones or tumors can cause irritation and overactivity, though these are less common causes. Hormonal changes, particularly in women going through menopause, can affect bladder function. Estrogen helps maintain the health of the bladder and urethra tissues, so when estrogen levels drop, you might develop overactive bladder symptoms. Age-related changes are also common. As we get older, our bladder muscle can become less efficient, and the signals between the brain and bladder can become less precise. How common is this problem? You are absolutely not alone in this. Overactive bladder affects about 33 million Americans. That's roughly 1 in 6 adults. It becomes more common as we age, affecting about 30% of men and 40% of women over age 75. But here's what's really important to understand. Just because it's common doesn't mean it's normal or something you just have to live with. The impact on your life. Let me be honest with you about how significantly overactive bladder can impact your quality of life. I've had patients tell me they've stopped going to movies because they can't sit through a 2-hour film without multiple bathroom breaks. They avoid long car trips. They research where every bathroom is before they go anywhere. They wake up exhausted because they've been up all night going to the bathroom. Some patients become socially isolated because they're embarrassed about their symptoms or worried about having an accident. They might stop exercising because physical activity can trigger urgency. They might even avoid drinking fluids, which actually makes things worse because concentrated urine is more irritating to the bladder. The psychological impact can be significant too. Many patients develop anxiety around their bladder symptoms, constantly worrying about where the nearest bathroom is or whether they'll have an accident. This anxiety can actually make the symptoms worse, creating a vicious cycle. Diagnosis. What to expect if you're experiencing these symptoms? The first step is to see a healthcare provider, preferably a urologist. We'll start with a detailed history. I want to know exactly what symptoms you're having, when they started, what makes them better or worse, what medications you're taking, and how much this is affecting your daily life. I'll often ask you to keep a bladder diary for a few days. This means writing down every time you urinate, how much you drink, and when you have urgency or accidents. This gives us objective data about your bladder patterns. We'll do a physical exam, including a pelvic exam for women to check for prolapse or other issues. We'll test your urine to rule out infection or other abnormalities. Sometimes we might do additional tests like urodynamics, which measures how your bladder fills and empties, or cystoscopy, where we look inside the bladder with a small camera. Treatment options. There's hope. Here's the good news. Overactive bladder is very treatable. We have multiple approaches, and we can often significantly improve your symptoms, if not resolve them completely. Lifestyle modifications are always the first line of treatment. This includes bladder training, where we gradually increase the time between bathroom visits. Pelvic floor exercises, also known as Kegels, can help strengthen the muscles that support bladder control. We'll also look at fluid management, not restricting fluids, but timing them appropriately and avoiding bladder irritants. Medications can be very effective. We have several classes of medications that can help calm an overactive bladder muscle. Anticholinergics like oxybutynin or tolterodine work by blocking the nerve signals that cause bladder contractions. Beta-3 agonists like mirabegron work by relaxing the bladder muscle during the filling phase. Advanced treatments are available for patients who don't respond to first-line therapies. Botox injections into the bladder muscle can be very effective. We inject small amounts of botulinum toxin directly into the bladder wall, which temporarily paralyzes the overactive muscle. Nerve stimulation therapies like sacral neuromodulation, also called a bladder pacemaker, can help restore normal communication between the brain and bladder. Myths and misconceptions. Let me clear up some common misconceptions I hear from patients. First, I should just drink less water. This is actually counterproductive. Concentrated urine is more irritating to the bladder and can make symptoms worse. You should maintain adequate hydration. Second, this is just part of getting older. While overactive bladder is more common with age, it's not an inevitable part of aging, and it's absolutely treatable regardless of your age. Third, Kegel exercises are just for women. Pelvic floor exercises can be beneficial for both men and women with overactive bladder. When to seek help, you should definitely see a healthcare provider if you're urinating more than 8 times during the day, waking up multiple times at night to urinate, having sudden, intense urges that are difficult to control, or if you're having any episodes of incontinence. Don't wait until it's severely impacting your quality of life. Also, seek immediate medical attention if you have fever, chills, back pain, or blood in your urine, along with urgency and frequency, as these could be signs of a more serious condition like a kidney infection. The bottom line, overactive bladder is a real medical condition that affects millions of people. It's not something you caused, it's not something you should be embarrassed about, and it's definitely not something you just have to live with. We have effective treatments available, and most patients see significant improvement in their symptoms. The key is to seek help early rather than suffering in silence. The sooner we can start treatment, the sooner you can get back to living your life without constantly worrying about where the nearest bathroom is. Remember, your bladder symptoms are affecting your quality of life, and that matters. You deserve to feel comfortable and confident, whether you're at work, traveling, sleeping through the night, or just going about your daily activities. If you found this information helpful, please share it with others who might be struggling with similar symptoms. Too many people suffer in silence with overactive bladder when help is readily available. And remember, take care of yourself. You're worth it, and these symptoms are absolutely worth addressing with a healthcare professional.